Good afternoon and welcome to today's event, our spring business and healthcare town hall meeting. My name is Warren Call, President and CEO of Traverse Connect, and on behalf of our board of directors, thank you for joining us today. The purpose of today's event is to provide business and community leaders across Northern Michigan with a status update regarding the current state of the pandemic response in Michigan and to share key information and an outlook over the next several months. I know we are all eager to hear from our medical experts, but before introducing our speakers, I'd like to take just a moment to thank Blue Cross Blue Shield of Michigan and Munson Healthcare for their support that has made today's event possible. Their partnership and leadership have been vital as we combat COVID-19 and work to build economic resilience and economic growth post-pandemic. Our speakers will cover a lot of ground today, and we encourage attendees to ask questions. To do so, please use the chat box function at the bottom of your screen. We'll be taking questions at the end of the presentations. This event will be recorded and shared on our website and YouTube page within 24 hours, so please share with your personal and professional networks. It's now my great honor to introduce our speakers for today, Dr. James Grant and Dr. Christine Nefce. We're lucky to have these two very accomplished medical professionals with us today, and we look forward to learning from their expertise and leadership in the medical field. First, Dr. Grant. Dr. James Grant is the Senior Vice President and Chief Medical Officer of Blue Cross Blue Shield of Michigan. Prior to his arrival at Blue Cross, Dr. Grant was the chair of the Department of Anesthesiology and Physician Executive of Perioperative Services at Cedars-Sinai Medical Center in Los Angeles. Before moving to California, Dr. Grant was professor and chair of anesthesiology at Oakland University, William Beaumont School of Medicine, and the chair of the Department of Anesthesiology at Beaumont Health Royal Oak Campus. Dr. Grant has held numerous positions in organized medicine. He served as the president of the American Society of Anesthesiologists, I'm sorry, I'm saying that incorrectly, the ASA Administrative Council, and chair of both ASA's section on fiscal affairs and the Committee on Executive Compensation. Dr. Grant has been on the ASA Board of Directors since 1999. He also serves on the board of the Anesthesia Foundation and the Foundation of Anesthesia Education and Research. Dr. Grant currently serves as the chair of the Delegation and Section Council on Anesthesiology to the American Medical Association and is a past president of both the Michigan State Medical Society and the Michigan Society of Anesthesiologists. Dr. Grant received his bachelor's degree of science from Michigan State University in East Lansing and his doctor of medicine from Wayne State University in Detroit, as well as his master's of business administration from the Indiana University Kelley School of Business in Bloomington, Indiana. I will now introduce Dr. Nefce. Dr. Christine Nefce is the Chief Medical Officer of Munson Healthcare. As Chief Medical Officer of Munson Healthcare, Dr. Nefce provides strategic direction for clinical initiatives and strengthening clinical practices across the Munson system. She also oversees system quality and collaborates with the of the service lines. Prior to joining Munson Healthcare, Dr. Nefce worked as the Chief Medical Officer at Intermountain Healthcare, a 22-hospital nonprofit system based in Salt Lake City, Utah. Dr. Nefce was the Chief Medical Officer for four of the hospitals representing the northern region of the system. Dr. Nefce graduated summa cum laude with her bachelor's degree from Bradford College in Bradford, Massachusetts. She earned her medical degree from the Uniformed Services University of the Health Sciences in Bethesda, Maryland, and completed her residency in pediatrics at the Uniformed Health Services Education Consortium, Wilford Hall Medical Center in San Antonio, Texas. Dr. Nefce is a fellow of the Academy of GE Fellows and the Intermountain Healthcare Executive Development Program. She retired as a lieutenant colonel from the U.S. Air Force Reserve in 2018. And with that, I'm very happy to introduce Dr. Grant. Dr. Grant, please take us away.
Thank you, Warren. Thank you for that very kind introduction. And really, thank you for everyone in the Traverse Connect for having me today, so we can talk a little bit more about COVID and what's going on in the state of Michigan now. And we're going to have some questions later on, and welcome any question you have at all, because this is what I'm here for. So let's take a look at infection rates. Next slide, next slide. So on the left side looks really good. Okay, no, next slide, previous slide, I should say. Okay, the slide on the left looks really good. That's our country, that's our positive test trends. You know, we peaked, it looks like middle of November, got a little bit of an uptick now, but unfortunately you see that little bit of the uptake now, a lot of it's really over 10% of it's coming from one state, and that's Michigan. Michigan has become the epicenter of COVID. Mostly it's the variant that we're seeing. And you know, there's just an article I read today that Michigan's the epicenter. Where what happened? Did we let our guard down? I think it pretty much in some ways it was all the above. But look at Michigan compared to the rest of the country, and look at the percentage. We went up over 7% in positive cases. Our number of our positive tests are 16-17% now. The World Health Organization says we can't really open up again until it's 5% consistently or less over a 2-week period. So we got a lot of work to do, a lot of work. And like I said, all eyes are on Michigan now. Next slide. These are our inpatient beds in the state, 79% filled, 81% filled. We've got hospitals, especially in the southeastern Detroit, southeastern Michigan area, Macomb County. All of our hospitals in Macomb County are filled to capacity. We got some problems here, and we look at our number at top. We're up 360 cases from the prior week. We're overtaking. We are contributing to the national sort of bump in COVID, and we've got to just say we've got to get it under control. I think you see down there's hospitals with 100% bed occupancy: Ascension and St. Joseph Mercy in Livingston, Beaumont Farmington Hills. The numbers keep rising, the patients keep getting admitted, and actually the patients are younger and younger. And that's what we're seeing now, younger and younger patients. We can't do it, we can't cure people with the vaccine, but we got to get the vaccine out, because if we can get the vaccine out, we can then get people so they don't get COVID in the future. Next. This is our 7th-day average of deaths. Michigan was up 200, and the funny part about deaths, we keep talking cumulative, and everyone says, oh, the deaths are going up. Well, the deaths are always going to go up because we're just trying to minimize the growth of deaths going up. So if you look at it nationally, we had 3,700 deaths last week. But what did we have? We had 5,300 deaths in the country, 232 deaths just in Michigan in the prior weeks. So Michigan is actually seeing a rate of recovery about 78%. We are having our COVID spike, but our deaths aren't as great as it was during the March crisis. So we're seeing more and more people come in with less and less severity. Next. So one of the common questions we get all the time is, well, what are these mutants? What are mutants? Mutants are, every virus has mutants. Every virus sort of changes itself over time. Viruses are very smart. They think if they change a little bit here and a little bit there, they'll be less able to attack them, less able to get to them. The variant that we're seeing here most of the time is what we call the United Kingdom variant. I think it's really what's overtaking Michigan right now. Now the UK variant, originally we thought it was just more contagious, and now we're being able to see now is it more contagious, but it might be more severe at the same time. The beauty of the UK variant, very frankly, is the vaccine is actually found to be very effective for the UK variant. And that's a really, really, really good thing. Next. So B.117, the UK variant, that's our number one. We have about 20,000 cases in the country. I'm not going to talk a lot about these other strains because we don't even know how many we have. The South African variant, the Brazilian variant, less than 500 in this whole country today. But the UK variant is what's hit Michigan so bad. It's hit all 50 states. The others haven't even hit all 50 states. It is more contagious. It is susceptible to the vaccine. So that's one message I really want to get out. The variants that are causing our problems in Michigan today are really, really, really sensitive to the vaccine. And that's a really, really good thing. Next. Vaccines. Everyone couldn't be more proud of our entire community coming together. The federal and the state government released the vaccines. They distributed them. They were appropriating them. They appropriated them to county health departments, to hospitals, to pharmacies, to retailers like Meijer and Kroger. And everyone's come together to give the vaccine. Physicians' offices, now that we're having different refrigeration requirements, they're able to get the vaccine to give them. And we have databases that show how many Michiganians are getting the vaccine at once. So we're really on top of it. Blue Cross Blue Shield is reaching out to all of our members all the time to encourage them at the safety of the vaccine. Because unless we get people vaccinated, we're not going to beat this. That's the key, getting people vaccinated. Next. So if you haven't heard the term Pfizer, Moderna, or even Johnson & Johnson in the past couple months, I don't know where you've been, or if someone's locked you up and, occluded off all kind of sensory to the outside world. But that's what we're doing. These are our vaccines now. We've had the Pfizer out since mid-December. Moderna just came about a week after that. The Pfizer and the Moderna vaccine are very, very similar. The requirements are, if you have Pfizer, you have to get your next one 21 days later and your Moderna 28 days later. They're both about 95% efficient. They both attack the variants. They have different refrigeration requirements, and we're getting them out to Americans all the time. The Johnson & Johnson vaccine. The Johnson & Johnson vaccine is, I know you know it's on pause. It's on pause for clotting reasons right now. The government's taking a look at it. I suspect from everything I read that Johnson & Johnson will be back in the market hopefully within the next week. Government's doing all their due diligence to make sure it's safe. Next. So originally what we would have seen is hospitals at that 2.2 million mark. But now in the past few weeks, what we've seen is most of our doses of our vaccines are going to our local health departments, who they've all done an incredibly great job of getting the vaccine out. Local health departments, hospitals, pharmacies. Ford Field's given out, that number actually is a little old, that number is even higher, 155, I think it's about 180,000 vaccines now. And the number of physician practices getting the vaccine and giving the vaccine is growing every single day. So, couldn't be more proud of the work that's being done in Michigan to get the vaccine out. Next. Here in the number of the residents, I'm sure this group actually has more interest in what's going on, or has incredible interest in what's going on in Northwest Michigan. And what we see here is the percentage of Northwest Michiganders that are receiving at least one dose of the vaccine is about 52%. And the percentage of all Michiganders that received at least one dose of the vaccine is 45%. Kudos to Northwest Michigan. Kudos to the work you're doing. We couldn't be more proud. You know what? There are concerns about safety of the vaccine. The vaccine is safe. I will tell you, I got the vaccine. I will tell you, my wife got the vaccine. My parents got the vaccine. My kids got the vaccine. It is a safe vaccine. There's a lot of mistrust. A lot of it, I'm sure Johnson & Johnson's not helping, but I think as time goes on, we're seeing what the issues were with Johnson & Johnson. We're not seeing a lot of side effects of the vaccine, but what we are seeing is we're seeing a lot of people not coming to hospitals now. What we're seeing is when we take a look at this growth of numbers of COVID, it's not vaccinated patients coming in. Every now and then you'll see a vaccinated patient, but they're coming in with incredibly, incredibly mild symptoms. We're not seeing the severity with a vaccinated patient. Some in our community, some of the African-American community want to do a wait and see. There's long-term history with hesitancy with vaccines. We're trying to get the message out that it is a safe vaccine, and the only way we're going to beat this is that if we can get as many people as possible vaccinated. Next. As the national state efforts to vaccine grow, over 45% of Michigan residents have received at least one dose. That's really good. And why do you see at least one dose? One of the things that we're learning now is the one dose will get you some immunity. It won't be perfect. The second dose is really what gives you that last kick, but you'll get some immunity with the one dose. That's why in England, they were given one doses for a while. You need both doses. I'm not going to tell you don't. You need both doses. Let's get one dose in first, then you get 2 weeks to wait or 3 weeks to wait to get the second dose. If you're in J&J, you're one and done. We've got to get the numbers up. We're doing their best, and I couldn't be more proud of everything everyone's in our state is doing to get the state vaccinated. Next. We continue, the vaccine progress continues to improve. Look at Michigan there, 30% over age 18 is getting it, 28%. People ask me all the time, what about my kids? The research that's being done on children is actually going at light speed right now. think everything we've said, and Christine may talk about this a little later, being a pediatrician especially, end of the year, maybe we'll get the vaccine for the kids. But in the meantime, we got to get all the adults vaccinated. Over half of America has received at least one dose. About a third is fully vaccinated. Over 80% of Americans over 65 have gotten one dose. And about 65% of over 65 are fully vaccinated. So we're getting the world vaccinated, and until we start getting, while we're getting them vaccinated, that's the key to getting the numbers down. Next. So I'm just going to go through this briefly because I think it's everything you've already seen. The vaccine, Pfizer, Moderna, they're about 95% effective. Now you say, wow, 95% effective, why not 100? 100 there's nothing that really is 100% effective. Your annual flu shot that you get, that's only 50% effective. So the 95% is really good. We're not seeing vaccinated patients coming into the hospital sick. That I'll tell you. Now you say, well, Johnson is not as effective. Well, the reason I will tell you that you have the 95% on the mRNA vaccines, which are Pfizer, Moderna, and 63% on the adenovirus vaccine, Johnson & Johnson. The studies to determine efficacy were really apples and oranges, and it's really the numbers are deceiving that they're so different, but the Johnson & Johnson vaccine is just as effective as the others. Next. Let's look ahead. At this rate, we're getting about 3 million doses into Americans' arms every day. That means that hopefully we'll have 75% of the population vaccinated by July 1st. We gave about 24 million doses just in the past week, an increase of close to 70 million doses since the beginning of April. We talk about herd immunity, and people always ask me, what is herd immunity? Why do we want to get to that 75 or 80% number? If we can get 75 or 80% of the population, the chances of that 20% getting it aren't very likely. What's herd immunity? I like to use a simple example for herd immunity. Herd immunity is, let's say I have 10 people over to the house for dinner, but one person did not get vaccinated for one reason or another. The chances of that one person getting it are very unlikely because the other 9 have been vaccinated. So what herd immunity is someone who's not vaccinated getting it by virtue that the rest of the population is vaccinated. Next. So when's the pandemic going to end? It's going to be multifactorial. Vaccine availability. We don't know yet how long the vaccine lasts. We know it lasts at least 6 months now. But right now, our major companies, Pfizer, Moderna, J&J, they're all working on boosters that will include the variant, boosters that you take every year, boosters that you take every 2 days. We don't know those numbers yet. We're going to figure out, what are the emerging variants? What's coming out? What will the boosters accomplish? What will the boosters get to? When will you get the boosters? We can't be getting into the boosters yet, very frankly, until we actually get the initial doses into people. And then once it's we don't think it's going to be a seasonal thing like with our H-flu shots, but we think it's going to be a booster. We just don't know when, and we don't know how often. Next. This slide has a lot of words on it, so I'm not going to really go over most of them, but I will tell you that the beauty of COVID really is Blue Cross Blue Shield of Michigan, and you've heard me say this, many of you have heard me say this multiple times. Blue Cross Blue Shield is more than a healthcare payer. We're a healthcare partner. And we tried to be a leading voice in COVID. We tried to be a leading voice in getting PPE or personal protective equipment to our providers, sending out masks to our seniors, sending out hand sanitizer, having commercials to encourage people to get the vaccine. I can't tell you how many radio spots, television spots, to get the message out there. What is COVID and how are we going to beat COVID as a community? It's not about health insurance premiums. It's about keeping our community safer. And that's what we've been trying to do. On our website, bcbsm.com, there's a banner right up top to go to our COVID information page where we're updating it every day so that Blue Cross can be this trusted source of truth for you for anything you need related to COVID. Our members are getting vaccinated. We've actually invested over $600 million in additional member benefits. One of the things that we've done, we waived our member tests, we've waived copays for COVID-19. We've converted to telehealth visits. We're coordinating with our physicians in our hospitals to meet their needs. We're suspending some requirements that we've normally traditionally needed. We're doing everything we can to make sure our members are safe. It's been over 1.5 million postcards we've delivered on the vaccine to our seniors. We're supporting direct outreach to over 6,500 of our Medicaid members. Our educational videos have actually received over 27 million impressions. So we're all over and trying to make sure we get that message out and make sure our community is aware of COVID and make sure our community knows whether you're a Blue Cross member or not, that Blue Cross Blue Shield of Michigan is there for what you need to get through COVID. Next. Basically what I just said, we're here for what you need for all Michiganders, regardless if you're a Blue Cross Blue Shield member or not. We're here for a healthier Michigan. We want what's best for a healthier Michigan, and we're together as a vaccinated public. We are going to beat this thing, and I can't thank the Traverse Connect group enough for giving me this opportunity to share some time with you today. If you have any questions at all, do not hesitate. Just go to bcbsm.com, adenovirus, or bcbs.com. There's a banner right there. Every day we update it. It's going to be updated information on what you need to beat COVID together. So Warren, back to you, I think.
Thanks, Dr. Grant. We appreciate your comments and hope that you can stick around for a few more minutes until after Dr. Nefce to answer any questions that might come up. And with that, I will turn it over to Dr. Nefce.
Thank you. I'm going to try to share my screen here. And hopefully we will get this together here. Okay. Can you see my screen?
We have your presentation screen up. If you switch screens to see just the slide.
Let's see. So you're not seeing my.
We see your slides and your notes.
Oh, okay. Let's go back then. Sorry about that. Got to get it into the different presentation now. I'm not sure quite how to do that actually.
And we can see it just fine. If you would like to, restart it, it might work.
Let's see. We'll try this again. I apologize. We tested this even beforehand and it. Okay, let's try this now. All right, well, we got a very broad view and we're gonna narrow it down a little bit to our local area. So let's start with our current state. I apologize, the state didn't update their database today, so these numbers are from yesterday. But if you look at Michigan, and we just sort of saw a review of this, you can see here we're right in the middle of a surge here, similar to what we saw back in the fall. So currently we're at about a 15% rate for the state of Michigan. And you can see there on the upper right-hand side, some of the cumulative numbers. These are our regional numbers, and you'll note that our 16.6% rate is actually higher than the state's. So that's the first time that we've seen that. And if you look down at that bottom graph, you can see that our percent positive is higher now than it even was in the fall surge. You'll see there too, our cumulative cases for our region, and this is roughly region 7, so kind of the western part of the northern part of the state. Here are our numbers for months in healthcare specifically. So again, you can see we've reached some of our highest numbers since the pandemic started in our inpatient hospitalizations. Again, these numbers are from yesterday. As of this morning, we were at 93 patients, but many of our hospitals are quite full in the 90th percentile. Our ICUs are very, very busy. So these are some of the highest numbers that we've managed again since this pandemic started. So the good news is the vaccines. I think we just got a good picture of how well we're doing as a state on the vaccines, and specifically how well we're doing in the northern part of the state. So Munson Healthcare, either through our mass vaccination clinics or through our allocations to primary care clinics and with the health departments, have administered over 68,000 doses. I want everybody to know, everybody in Michigan that is 16 and older is now eligible for a vaccine. And there are many, many places across our northern Michigan region where you can get vaccine, local health departments, retail pharmacies, and many of our clinics. As was stated earlier, we are seeing an inverse relationship between being vaccinated and being hospitalized. So the majority of people who are being hospitalized now are not immunized. The majority are much younger than what we saw previously. So in the past, most of our patients were, the mean age was in the 70s, and most of them were over the age of 65. Now the mean age is in the low 60s, and 2/3 of those patients are below the age of 65. So definitely seeing an increase in younger people being hospitalized with COVID-19. Just to reiterate, vaccine is the safest and quickest path back to us leading a more normal way of life. We reviewed, so I'll just go over this very quickly. We have both the Pfizer and Moderna vaccine available right now. They're both mRNA doses or mRNA vaccines. They are 2 doses and highly effective. We do get a lot of questions about which vaccine should I get, and we would say get whatever vaccine's available to you. All of them are safe and highly effective in preventing the spread of COVID-19, in preventing severe illness, and in preventing death. We do get lots of questions about herd immunity and about vaccination and its safety. So I did want to take this opportunity to address a couple of those. So one we hear quite often is that the traditional research and development and then the approval processes for these vaccines were not followed and they were rushed to market. I think it's really important to understand that the technology around mRNA vaccines and other have been in development for a very, very long time. What this pandemic did was actually provide a lot of money and personnel to really push forward much more quickly the development of an existing technology. The same steps were followed as they would be for any other vaccine. The real change in timing was that some of the steps were overlapped. So instead of finishing one trial and then waiting and then starting another one, they just overlapped those so that we could get the information we needed a little bit faster than is typical. Another one I hear for this one as well as the flu is that if you get the vaccine, you can get COVID-19. That is also not true. Neither of the viruses or neither of the vaccines that we have right now contain virus. Really, all of the vaccines do is trigger a message in your body to create an immune response against a certain viral particle, a protein that is part of the COVID-19 virus. So there's no virus that's injected into you. You cannot get COVID-19 from getting vaccinated. Here's another one. The COVID-19 vaccine can alter your DNA. Also not true. If we had that kind of technology, we could solve a lot of our big major health problems like cancer and type 1 diabetes and a lot of different really horrific diseases. So that is not the case. They don't enter into your cell's nucleus, and that is where the DNA is located. So no alteration of the DNA. Also, the vaccine does not cause infertility. That was it's a pretty common myth that surfaced from a false report from a scientist who elevated some concern about women in particular, and that really has blown up on social media as being much broader of causing infertility. That there's no evidence that the vaccines impact fertility at all. The side effects from the vaccine are dangerous. So, we mentioned before, no vaccine is perfect in its efficacy, nor are they perfect in their safety. There are sometimes serious reactions that can occur as a result of any vaccine, and COVID-19 is not an exception. But those side effects are actually, those serious reactions are actually very, very rare. They are, because of the situation we are in, getting a lot of attention on media, but they are actually quite rare. What we do know is that people that have significant allergies that require an EpiPen are probably at more risk and should consult with their primary care provider before receiving a COVID-19 vaccine. But the majority of people will have very mild to moderate side effects, and they are typically quite brief. Here's another one a little bit near and dear to my heart. The COVID-19 vaccines are not safe for children. This is also not true. We know that the Pfizer vaccine right now is safe and approved for children 16 and older. We are expecting an emergency use authorization for Pfizer down to 12 years old very soon. And both Moderna and Pfizer are performing clinical trials in children, and we expect to get some good data from them very soon, and then hopefully be able to immunize our children who are sometimes some of our most vulnerable members of our population. So to lead into that, COVID-19 is not serious among children, also not true. You know, there's a lot of media about how children don't get COVID or children don't pass it on to each other. I think we know from our current situation here in Michigan that that is not the case. And the more children we're seeing with COVID-19, the more are contracting and spreading it, the more children we're seeing admitted with complications. The complication you hear the most of is multisystem inflammatory syndrome. That is a multi-organ kind of immune response that we are seeing in children. It's quite significant and quite dangerous. We've had over 100 children in Michigan with that diagnosis, well over 3,000 in the United States, and unfortunately, quite a few deaths across our country from this. So children do get it. The mean age for children getting MIS-C is 8 to 9 years old. So these are young children who are getting serious illness. And unfortunately, they can't yet get the vaccine. So one of the only things we can do to protect them, besides our usual mitigation factors, is to get ourselves immunized. This is one we manage quite a bit. Now that I'm vaccinated, I don't need to wear a mask. So even with the vaccine, because we have such a high rate in our community and we haven't reached herd immunity, it's really important that we still wear masks. It is also still important that you keep your distance outside of your immediate household and you follow the hand hygiene. Basically, what can happen is we know even with 95% effectiveness of the vaccine, which is very, very good, that still means 1 in 20 people can get COVID despite being immunized. So if you think about that, that's 1 in 20 people. So because half at least of those 1 in 20 would have asymptomatic COVID-19, we feel because we have so many people still not immune to this, still not immunized, and such a high rate of positivity in our community, it's still really important that you continue to wear a mask to protect others around you in case you were carrying it with no symptoms and because of how high the rate is in our community. There is good news. People who have been vaccinated can visit other fully vaccinated people without wearing a mask. So, you know, the risk is so much lower with vaccination that the CDC and other epidemiologists feel that that is a safe thing to do. There are many places you can travel domestically without required testing or quarantining. And the other thing is you don't need to quarantine or get tested if you have an exposure, if you have no symptoms and you are fully vaccinated. So that's a big one for business owners to understand, you know, that their staff does not have to quarantine after an exposure if they are fully immunized and they don't have symptoms. I do want to just reiterate, though, regardless of your vaccine status, if you have any symptoms that would be consistent with COVID-19, we strongly encourage you to get tested. So as more people are vaccinated, the less opportunity this virus has to spread. And that is really the basis of herd immunity or community immunity that we are trying to support. I've said all along, we are all in this together and we all need to do our part. If you need information about where to get your vaccine, the Michigan Department of Health and Human Services has a great website. You can just enter in your zip code. You can also call this number. And then we also have lots of information either through our newsletter that comes regularly or by visiting munsonhealthcare.org. And that is the end of my presentation. So I think we're ready for questions now.
Yes, thank you, Dr. Nefce, and thank you, Dr. Grant, for your comments as well. We will now take some questions. As a reminder, please type the questions into the chat function at the bottom if you do have any, and we'll get through as many as possible with some time allotted here. Two things that came in while the conversation was going on, two questions that I know that both Dr. Grant and Dr. Nefce, you did touch on a little bit, but I think with the complexity of this issue, it bears repeating and maybe answering to a larger degree. I'm going to call on Dr. Grant first. Dr. Grant, the efficacy of the vaccine, especially the timeline there. The question is, will the vaccine wear off? And thoughts about the frequency of getting a shot after you've been fully vaccinated. I know that you said that there's uncertainty there, but maybe you could talk about that a little bit more.
Warren, we don't know how long the vaccine's going to last for quite yet.
All right.
We know that it goes more than 6 months. And so the research and the scientists are working on that right now. As far as when will the vaccine be effective, and the conventional wisdom is it's about 10 to 14 days after your second dose if you have the Moderna or the Pfizer vaccine. So the whole world will find out at once when we really think that we're going to need a booster shot. So we don't have quite the data yet.
Yeah. Certainly.
And Warren,
yeah, go ahead, Dr.
Yeah,
Nefce.
that's an example of that overlap we talked about. So, normally when you have vaccine development, you would wait, and then you would wait for long periods of time afterwards and test people. And this is one of those things that we brought it out, and now we're testing people to see how long their antibodies last. So that's an example of that overlapping that we're following and bringing information out. So to Dr. Grant's point, both Pfizer and Moderna did tests and found that antibodies last at least till 6 months. They'll do it again, and we'll find out at 9 months and 12 months and keep going from there.
Thank you. Another question, Dr. Nefce, that you had covered to some degree, but I think it's worth going into a little bit more detail. If someone is fully vaccinated, can they themselves still spread the virus to someone who is not? And I know that there's some questions out there from many people on that.
So I'm happy to take that one. That would be an example of having COVID being one of those 1 in 20 people who could potentially still contract COVID-19 despite being fully vaccinated and be asymptomatic and unknowingly spread it. So some people are saying, oh, we don't know if you could be a carrier. That's really like less the issue. It's really, you could have asymptomatic disease and not know it. It's much less likely than if you were not vaccinated. But that is a small risk. And again, it's a higher risk the higher our community spread is.
Very good. Thank you. This is a question that had come up in social media in the past regarding supplements. So I'll let each of you answer as you feel appropriate. Is it true that people could build their immune system by taking vitamins and supplements to boost their immune system? Does this help avoid contracting COVID?
You want to go, Christine, first?
Sure, I'm happy to start. So, we know that there are certain healthy lifestyles that are going to make you generally a healthier person. Getting enough sleep, eating good food, exercising regularly, and in some cases, taking vitamins if you have some maybe some dietary considerations or that kind of thing. Generally, that's going to make you healthier and more able to fight off infections and go through an infection in a healthier way than somebody that didn't have those. But there's nothing in of itself with a dietary supplement that will make you immune to getting COVID. All that will do is make you a healthier person and maybe less likely to get really sick from COVID, but it's not going to build your immunity specific to a particular virus.
Thank you.
Dr. Grant,
I'll give you, I couldn't agree with you more. And I'll be honest with you. Yeah, you hear zinc. I take zinc. You hear vitamin D. Yeah, I take vitamin D. But the first nanosecond I was offered the vaccine, I was in line. So the rest of them, I took zinc even before we knew what COVID was. It sort of was good for, fighting off colds and that kind of stuff. A lot of the vitamins hurt you? No, not at all. But you know what? They're not going to supplement for the work the vaccine is going to do.
Very good. Thank you. There are a number of comments in the chat about the political aspects of this. We won't get into all of that, but I would say that to paraphrase what we're hearing from both of you doctors as well as the medical community, we all need to do our part to continue the mitigation efforts for quite some time to come. Could you talk a little bit about the necessity to do that even as the vaccine rolls out?
I'll be real quick. As the vaccine rolls out, till the world's not totally vaccinated, we have to continue face masks. We have to continue social distancing. We have to continue, hand washing. It's interesting. Blue Cross Blue Shield, our number of claims for something similar like H flu, or the flu what you take every year for the influenza shot. Our vaccines, because we're face masking, because we're social distancing, because we're washing our hands, because we're so cognizant of it, our claims for something like influenza have gone down by 80 to 90% this year, which just shows how these respiratory viruses, how contagious they are in the air. So we will continue the risk benefit of wearing masks, of social distancing. It's not very high. Putting on a mask is not a very risky event. If this can help us get through this, God, how I'd like to say it is, we have light at the end of the tunnel. We're in the middle of the tunnel, but when we're almost there, we can't let our guard down now. Christine, you want to add to that?
I think that's exactly right. I mean, we know that masks work well, and we know that because we had virtually no flu in our community this flu season. It just never got a foothold, and so was unable to spread. So again, we've talked a little bit about the asymptomatic infections people have, and when you have a high community spread, that risk is higher. So it's really until we get closer to that herd immunity and our levels of spread get much lower. Until that happens, we need to continue to wear our face masks. There's been lots of good studies since this pandemic started showing the efficacy of face masks and how they work in communities. And we've just tried all along, even though it's been, I think, a little frustrating for people because sometimes the messages change as we learn more. We really are trying to base our recommendations on the best science that we know at the moment, and then trying to be adaptable when we get new information.
Great, thank you to both of you for that. One question I think that probably I know the answer, but I think it's important again for community education. Once we reach the point where there's enough vaccine available for those who want it, does it make sense to get back in line for another round of shots for extra protection? I'll let Dr. Grant, if you want to take that one first.
No, first of all, I don't think anyone's going to give it to you, and I don't think it's going to provide you any extra protection, to tell you the truth. Christine, I'm going to answer that.
That's exactly what I would have said. Not yet. Well, when we find out when and if a booster is needed, we will let everybody know and do everything we can to recreate what we've done so far in getting large numbers of vaccine available. But right now, that's just not the case.
Yeah, and I will say, now that we mentioned that, if you're talking about a booster, the booster is not going to be the same what you see today in the initial. So when we do get a booster, it's going to be a little bit of a different composition.
Great. We have a question also about ivermectin for COVID treatment being a successful preventative. I'm not familiar with the substance or the drug that's being mentioned here. I don't know if either doctor has a comment on that.
I'm going to punt that one. I have no idea.
Yeah, so ivermectin actually is a really common pediatric drug because it's an anti-parasite drug. There have been some studies, but the level of ivermectin that was used in those studies was actually at a toxic level. So in talking to our infectious disease experts and others, there's really no good data that using ivermectin in non-toxic doses and the normal doses and safe doses we would use it is effective as a treatment.
Great, thank you. We have reached, just as I say that, we've got a couple more questions that have come in. As we talk about getting the vaccine out into the community, is there a way that a company could invite Munson or perhaps the health department, if you know, about getting getting the vaccine out to their facility for their employees?
Absolutely. We have a vaccine steering committee for Northern Michigan. It's all the health departments and Munson Healthcare. And so you could either, depending on where that person is, they could either contact their local health department, or they could even send me an email, and we will look and see what the situation and environment is and see what we can figure out. Certainly we're going out to schools in the near future. and had some mass vaccination clinics for our teachers. So, getting out to some businesses, again, it just kind of depends on some of the logistics, but we're happy to look into that as a possibility.
Great, thank you. Again, we've had some questions and comments regarding the political aspects of this. That's our job here at Traverse Connect to field and address on the business's behalf. So please do direct those to my team, and we'll do our best to address them. But maybe to finish up, from a standpoint of supporting what the medical community is putting out there, what can we as business leaders do in the community to help support our frontline medical providers and better get the word out? What else can we do to help you?
Well, I just had a conversation with one of my frontline providers, and what he asked for was patience and grace. So I would say, we are all in this together. We share everybody's frustration. We live in the community too. We understand what it's like not to visit our loved ones in the hospital, and, to have businesses shut down and the impact that this has had. But the reality is we're in this together, and it can't just be the hospital or just be the health department or just be the schools. We are all interconnected. And I would just ask everybody to continue to follow the science, be kind to your healthcare providers and your health departments who really are experts in trying to do the best they can to do the right thing for this community. And I do feel optimistic that we will get through this together and there is an end in sight.
Thank you. Dr. Grant, do you have any comments for that?
Yeah, I couldn't have said it better. The end is in sight. I gotta encourage everybody to get vaccinated. Any anxiety over the J&J when it comes back in, I'll tell you, yes, there were some clots, but those clots were far less than the number of clots that people got from smoking this week, far less than the people that got clots from COVID this week, far less than the number of clots that people got from birth control pills this week. The J&J vaccine, once the FDA goes through their due diligence, I can guarantee it's going to be back on the market. Moderna's on the market. Pfizer's on the market. Our supply is finally exceeding the demand. Get the vaccine. The only way we're going to reach herd immunity is people getting vaccinated. I can't encourage everyone enough to get the vaccine. We're going to beat this thing together.
Great, thank you. Just for the audience, we do have some questions that have come up regarding the requirement of getting the vaccine at the workplace, what employers can and should do, and how that works with potential compensation claims. That'll be a subject of another event that we will be doing later. The U.S. Chamber of Commerce has some information, and we will be using their reference materials to host another discussion. Finally, there is vaccine available at the school and various other places around the community, so please do keep that in mind as you look for vaccination opportunities for yourself, your family, and your coworkers. That is the extent of our questions for today. I want to thank you, Dr. Grant and Dr. Nefce, both for your knowledge, your outlook, and your leadership in our community's pandemic response. We greatly appreciate you being here with us today. Thanks once again to Blue Cross Blue Shield of Michigan for sponsoring today's event and for Munson's involvement as well. And thank you all for joining us today and for your leadership in our community. Again, we want to make sure the word gets out there. So please do share this information and the recordings that's available with your team and your network. Thanks once again, everyone. Have a great afternoon.
Thanks, Warren.